Well, good morning, Hawaii. Thanks so much for tuning in. It is Monday, March 29th. Hard to believe it's already the end of March here. I'm Ryan Kalei-Suji, joined by Yunji Denise. And Yunji, today we have another special guest who always attracts a lot of questions and a lot of engagement.
Yeah, we see a lot of you tuning in right now. Please type your questions for Lieutenant Governor Josh Green, who is joining us from his office live at the state capitol. We're so excited to talk to him because, as you know, he is leading the charge on vaccines, and he is also heading up the Safe Travels program. So please welcome the Lieutenant Governor. Thank you so much for being here. Big day today because we are opening up the vaccine to another category of people. Let's start there.
Yeah, so 60 and older, anyone in the state of Hawaii who is 60 years old or older should go and sign up and be vaccinated. This is a great achievement because we've seen the effects and they're working. We now know that those who are 65 and older represent the lowest rate of infections in our state. We've seen the case counts drop off like a steep cliff for those who have gotten vaccinated if they're 65 and older, and fewer people in the hospital that are in that age category. So we expect that we'll see the same thing with 60 plus, and in 2 weeks or so, when we can go down maybe to 50 and older, we'll again see that incremental improvement and get a lot safer. But as you know, we're not out of the woods. We had 103 cases today. We had 36 on Maui. Our positivity rate's 1.77%, and there are 1,158 active cases in Hawaii. So we've seen a general uptick in cases for the last 2 weeks since we opened to Tier 3. So all these things come back to the first point, which is please go get your vaccination if you're 60 plus.
Let's talk about those rising numbers. There are some in the community that are concerned. There are others in the community that are afraid that we may be heading back to a shutdown or moving back down the tier level here on the island of Oahu because we're seeing these numbers increase. What are your thoughts on some of these rising numbers, these triple-digit numbers that we're seeing over the last few days?
Well, the triple-digit numbers are real. They are a reflection of increased activity. There's no reason to blame anybody. It's just their reality of people gathering and not being quite safe enough. A lot of people have been getting a false sense of security because we've delivered 604,570 shots, vaccination shots in arms, plus another 100,000 from the military. And so people think we're safer, but we only have 25% of our people vaccinated right now. So we still are very vulnerable. The case counts are going to keep going up if we're not a little smarter. We need to still socially distance and still wear masks. And we have to do it well beyond getting most of our people vaccinated. Otherwise, we will see case counts up back in the 200 range, and that will certainly trigger a setback. I know that the mayor, Mayor Blangiardi, who I'm very fond of, is inclined to continue to allow us to be in Tier 3. He's inclined to have business operating as long as we don't have too many people in the hospitals. We have plenty of hospital beds. But, once you get a couple hundred cases a day, the active case count goes way up. Then the hospitalizations follow. And that's what we're seeing right now. We were just a few weeks ago, let me flash back to my notes. On the 15th of March, 15th of March, we had 693 active cases 2 weeks ago. Today we have 1,158. So you can see the cases have been accumulating over the last 2 weeks. And we 2 weeks ago had the number in the hospital was 26. Today we have 48. So they are always a reflection of one another. And that is just a reality. So if we keep the lid on, our numbers will gradually fall back down again. We have a lot more protection with the vaccination every week, but we are basically trying to stay out ahead of this wave. And it would be better for us to stay out ahead of the wave. So if the cases keep going up, I would not be shocked if we have to fall back to Tier 2. Nobody wants that. So let's be instead safer with our masks and social distancing.
I know you just said that the people who are 65 and over represent the lowest percentages. Let's talk a little bit about who is contracting this disease and where we're seeing the most of the spread.
So people who are age 18 to 44 now are by far the largest group catching COVID. I mean, it's a big difference. The delta between those guys catching COVID at a much higher rate versus older people, it's just a huge difference. In a way, that's good because most younger people don't get super sick. Although I was in consultation with the Maui Community Hospital today, they have a lot of young people in the hospital, more people than they have had historically. Right now, there are 22 individuals hospitalized on Maui alone out of the 48, and a lot of them were in their 30s and 40s. So that's who's getting sick. They're not immune from catching the disease, obviously. They're not protected from having to be in the hospital, and they are not even protected from dying. You can die from COVID in your 30s and 40s, especially if you have underlying health conditions. So I would not be taking risks. I would not be going to large gatherings at all. And I would certainly be wearing my mask if I was out, if I'm a young person, because you will catch COVID otherwise. In about 6 weeks, we're going to have a ton of extra immunity, but we don't have it yet. And so, yes, we've protected our most vulnerable people, which is great, because otherwise we'd see a lot more people in the hospital right now. But young people are getting slammed by COVID at the moment. And so we have to be more careful.
Speaking of that, I want to bring in a question from Heidi. She's saying, how will we assist HPD to control illegal rave parties? We saw over the weekend that happening out in Kapolei with police coming in and breaking up one of those parties. What are your thoughts on the enforcement wise? Because it seems that people are maybe just getting tired of the rulings and all of these regulations, and they're letting their guard up, and things like these rave parties are happening. What are your thoughts on this in terms of enforcement and how HPD and maybe the state can help to assist to enforce some of these?
I hate to say it, but if you hear about a rave, call it in. Call it over to the police and get them to break it up. I don't want anybody arrested, but the party's got to be broken up. You know, it used to be I complained about people taking ecstasy at these parties. Now I worry about them getting intubated from catching COVID, okay? And please don't take ecstasy, and please don't spread COVID. Got two things to worry about now. So rave parties are a bummer for us right now. There will be plenty of time to have raves in the fall, in the winter. Please rave then, but not until we get through COVID, because it's just going to spread like crazy. And remember, you're at a rave, you're 27 years old, you're going to give it to your 48-year-old mom. I'm telling you, she can't get vaccinated until May. And so you go to a rave, you make out with a stranger, and then you catch COVID, and then you take it home. And that's what's happening. So please rave later.
Okay. This is an interesting question from Mary. How many tourists are testing positive while here? Obviously, it's spring break. We've seen, if you go out to the beaches or to any of the tourist areas, Lahaina, Kona Town, Waikiki, we see a lot of visitors coming. That's great for the economy. How are they contributing to our numbers, if at all?
Very little. There's a new study that came out of The Lancet, which is one of the best journals in the world. They've been operational since 1823. They showed that pre-screening, which we're doing, is decreasing case counts by 88%, the potential for any cases coming into a state like ours. So we don't see much travel-related cases, although people can catch COVID here if they're unlucky. We have seen a couple cases of people as they test on their way out. We had an interesting exercise out of Maui where they tested people prior to departure, and they found 2 people were positive. Tiny number of studies. So the study itself probably didn't have any special value, but the interesting part was some people catch COVID when they're here, I think. Not a lot, though. We still have the lowest rate of COVID in the country. We have the lowest mortality rate across the whole pandemic, but that's not much of a concession if you happen to be the person that catches it. I'm not worried about travel-related cases right now. I'm only worried about clusters and spread at the present. And the clusters and spread have been very significant on Maui, where they're really champs. I mean, they're working hard. They have opened their county completely, and that provides for survival and economic opportunity for families that are struggling. But it also means that there are extra COVID cases at times. And if you look at the cluster reports, you see some have been at restaurants, some have been at bars, some have been at one church. I mean, they're all over the place. So be real careful is all I can keep saying to people. Whether you're at a bar or a restaurant or at a church service or anywhere, you should be wearing a mask if you're outdoors. And then when we have everyone vaccinated in about, well, the majority of people by the end of, I would say, end of May, early June, the majority of people who want it will have had at least a first shot. We're going to be a lot safer. It will be harder to spread COVID. In fact, it will be difficult to spread COVID. But until then, there are risks.
In speaking about Maui and those case rises, that brings up another question of should we do away with the required testing and quarantine for inter-island travel? We know that there are many residents that would like to be able to travel to the neighbor islands without having to go to the testing. Do you still believe that that is something that we should lift, knowing that Maui's numbers are now higher and with Oahu's numbers going up, or do you think that we should hold off on that for the time being.
Well, the irony is we're just one state. So whether there are cases in Maui or there are cases in Oahu, it doesn't really matter. The only part of the inter-island quarantine that made any sense at any point was preventing a surge in cases where there was no healthcare capacity. And Kauai always has had less healthcare capacity, so they made some compelling arguments to be a little safer. We went through that issue. I'm not interested in reliving that one. But right now, there's more than enough beds on Maui. There's lots and lots of healthcare access on Oahu. So having these kind of quarantines between islands is not particularly valuable. It just doesn't really do very much. I mean, we are ultimately one state and one state of resources. And by the way, we transfer patients when we need to. So that's not a big thing. I'm much more concerned about community spread of the virus, and that would not be affected whether or not you're community spreading because you're on a bus from one part of Oahu to another part of Oahu, or on some part of Maui and you're traveling over to Big Island. It's really immaterial. Also, it takes a ton of extra resources to police that, when I'd rather see us getting these extra 140,000 doses that we have in the state into people. I mean, using all of those resources to vaccinate individuals would be better than doing these checks, which may catch one in every 50,000 people go through the test and then don't make their inter-island trip. It's just very low value.
Let's talk about that cluster report. I want to take a look at that if we could, Ryan, if you would pull that up. We're going to start, I think, with Maui real quick. So this is something for viewers who don't know. The Department of Health releases a cluster report with the 14-day exposure settings every Thursday. It's something that I look at every week. When we look at something like this, tell us how we should be interpreting these numbers and what this actually means.
So this is a 14-day snapshot of where people have been exposed and then had spread. And a lot of spread usually is like one-to-one. Like someone catches it at their workplace and they go back to their significant other and they give it to their husband or wife or kid. But for these large clusters, you can see there are outbreaks at a specific other setting. For instance, in Maui, as we know, in the last 2 weeks, we had the outbreak at the prison. So at that correctional facility, there were 93 cases. There was one outbreak at a school, caused 8 cases. There were 2 outbreaks at bars or nightclubs, causing 16 cases. There was one outbreak at a church, which caused 25 cases. So if you look at these different events, basically what they tell you is a couple people caused an outbreak. Probably, if I don't like to pick on churches, they've been great. They've really done a good job keeping case spread down. But unfortunately, one individual who probably was an asymptomatic carrier of COVID spent 2 or 3 hours at a church and people weren't wearing masks that particular day. And then they end up all catching COVID. That's exactly what happens. So again, if people wear masks, none of these issues happen. At the correctional facility cluster, it's harder because obviously our inmates are in closer quarters. A lot of them have chosen not to be vaccinated, even though we've offered it over and over again. There are challenges, but we can put all these clusters to bed if we all wear masks and if we get vaccinated in a timely fashion.
And let's take a look at the Oahu numbers as well. I mean, just taking a look at this report here, we're seeing some of those numbers at restaurants as well. Are those types of outbreaks concerning to you when we see some of these numbers at restaurants and educational settings here on the island of Oahu?
Yes and no. I mean, in looking at this report, just the fact that over 2 weeks we only had 5 clusters total in a population of 1 million people is astounding. I mean, every single mayor, governor, lieutenant governor would kill to have these numbers that are in Honolulu. Now, the flip side is we have some spread by individuals, but pretty low, only 52 cases out of 1 million people today. But only 2 schools had an outbreak for a total of 22 cases. That's good, actually. And only 2 restaurants. We have thousands of restaurants, and we've only had 2 clusters. One had 11 cases in the primary setting, and then outside of that, they spread them to their friends or family after that. So, and only 1 construction site, and there were just 8 cases. This thing's really infectious. I mean, this virus, it spreads. So that's pretty amazing. But Maui did get hit hard. It's why we sent over, I think it was 10,000 extra vaccination doses, and why we're actually going to seek some extra support to get some extra nurses at Maui Memorial Hospital to help with their recent rise in cases. These things just happen. Again, it's no fault of anyone. It's a really infectious disease, and we're at the cusp of being able to say we vaccinated probably about half of our people. By May 1st, I'll say it again, we will have delivered 1 million doses in the state of Hawaii, and our population is only 1.4 million people. So that's going to be a huge milestone, and it will make a lot of these cluster cases impossible. We will not see clusters of any consequence once we have most of our people vaccinated.
I know you mentioned that Maui is asking for some extra resources. Do you anticipate having to transfer those patients to Oahu to, give more resources in case there are, car accidents or just normal things that need emergency care, or will it be enough to supply the hospital with the nurses that you talked about?
It'll be enough. I would be surprised. We usually transfer only for cases that require an extra level of care. They do a lot of great work at Maui Memorial, and really, let me just commend the doctors and nurses and social workers and the whole team there. They have been working so hard. It's just they have a smaller hospital and more patients than they should with COVID. But they have the technology. Not many people are on ventilators. I think it's 4 total. And so they have the capacity. It's just it builds week over week when they are unable to let down their guard and unable to, have some quiet time in the intensive care unit. But again, we've had plenty of ventilators and plenty of ICU beds. That's not been the problem. The problem is that we haven't quite vaccinated enough people to be having large gatherings, and we certainly shouldn't be having raves like we talked about. So these are the challenges. Everyone is so eager to get back to normal, and we've gone through so much that we're testing ourselves. We've vaccinated, yes, 604,570 doses, but it's not 1.2 million, and that's what we need for protection. And yes, we've been locked down and we're at tier 3, and it's okay to have somewhat relaxed rules, but it's not the best idea to push the envelope and risk spread, because once you see a cluster, then it takes a few days for it to burn out. And we've been there before. We saw what happened in July last year, how fast it spread. It should not happen like that again, because we have vaccinated a ton of people. But I would not rule out the possibility that we'll see cases in the 200 range again if we're not careful. If we don't take to heart the next 2 weeks, everyone should behave, in my opinion, okay? Everyone should behave as though we're back in tier 2 or tier 1. Go only out to dinner in small groups, wear your mask. Don't take any extra liberties with large events right now. Just because you can doesn't mean you should. But we are trying to survive economically, and I'm very aware of that. But just 2 weeks of mellow, calm, low spreading risk will make all the difference. And the last thing we want is to fight through a surge of COVID for 2 months while we're trying to vaccinate people. It will be much harder.
We are, as we talk about this vaccine rollout today, for those who are 60 and over, we are getting a few comments from those who are saying that they are going online to the vaccination page of the state, and they're not able to register under the 60 plus. Do you have any information about how those who are 60 years and older and now qualify in this next category, how should they go about registering to become vaccinated? And then beyond that, how will the state notify the next group and the different types of sectors of people when it is their time?
You bet. So if I were 61 years old right now, I would go to CVS or Safeway or whoever, the pharmacies. They've got vaccination scheduled appointments galore. They have a lot of space. They have had a lot of pukas in their schedule. So that's one really good way to go. But I will make sure the Department of Health knows that there has been a shortage of some available slots. We do have a lot of people getting their first and their second doses now. That's one of the positive consequences of vaccinating a lot of people last month is they're coming due for their second shots. And so a lot of the appointments have been reserved for them. But we have not taken full advantage of our pharmacy vaccination program, which is a very good blessing for us to have. People will just have to shop around a little bit. Things will open up a little wider in 2 weeks. We're continuing to get a lot of vaccine. I should share with you, let me do the big numbers, okay? So 604,000 shots given. 748,000 170 doses are in the state. So there's about 144,000 extra doses in the state scheduled right now. We are due to get 81,260 doses in this week. Breaking that down, 8,400 Johnson & Johnson doses, which are great, 28,400 Moderna doses, and 44,460 Pfizer doses will come into our state this week. They usually arrive on Mondays and Thursdays. So you're going to see a lot of things open up, Ryan, and it'll, a lot of times the providers, they've done great work at Pier 2 and the Blaisdell and all across the state. They open up when they see that these vaccines have arrived. And so that's the process that we're experiencing. So I know I preach patience, and I think people only can have so much patience, but look, we had 144,000 extra doses that are being scheduled, and you add these 81,000 doses. So that's 220,000 doses now that are going to be made available in the next 1 to 2 weeks. And that's a lot of people that'll be able to sign up.
And as that starts to happen, one of the conversations that we've been having for the last few months is on this idea of a vaccine passport. The governor, when he was on, called it vaccine verification. Stephanie says, what specifically has to happen to create a vaccine passport program in Hawaii? Is this something that's going to be dictated by the state, or do you think this happens at a federal level and we follow?
That's a pretty sophisticated, good question. So the feds are working on this. And in order to do a vaccine passport, or vaccine verification, whatever we want to call it, let's start from the beginning. All you really need is to be able to show that you're vaccinated, right? We could go old school. Old school would probably be good enough to show your vaccination card and your ID. If people falsified that, we will penalize them, and we would definitely check and audit periodically. Not a lot of people are that stupid to come for a vacation and face up to a $5,000 fine because they didn't want to do their vaccination, okay? It's very unlikely. But having said that, that is one option, going kind of old-fashioned. Still, what everyone would like to do in the modern age is to have a database where you can get an app, just like our Safe Travels program. You upload your vaccination card or verification. We get a QR code and you're good. That's what we're working on. First Vitals is a company here that does a lot of work with our Department of Health in the state of Hawaii. I was on the phone with them today. They're terrific. But they are coordinating with a lot of people. The Health Information Exchange, Hawaii Health Systems Corporation, the Vaccine Management System, VAMS. They're working with Straub and Queens. So you get an idea of how many people you got to get together to get this data worked out. That's our state level, right? And at the federal level, if the feds decide that they're going to put some extra resources toward it, we'll certainly accept it, but we would have to plug in to that. So what the federal initiative would do, they'd probably hire somebody like, I don't know, IBM or Microsoft or Salesforce or somebody like that, do a national initiative, but they would still have to hook into the state of Hawaii to get our data. So it's more likely that we will develop this internally and hook into a federal program. And that's probably what all 50 states will have to do. I like it because what it does is it fortifies our Safe Travels program. Come May, I think around May 15th, if we work as hard as we can at this, and we are, if we have this up and operational, you'd be able to either get a pre-test and travel to Hawaii, plus kids, because no kid's going to be vaccinated, right? And or you have your vaccine passport, and that should be enough. That would give people a lot of certainty as to their travel. Right now, people are somewhat reluctant to travel to Hawaii if they have to get the pre-test because they don't know if they're going to test positive within 3 days of their trip. Although, look at the numbers. We had as many as 24,000 people come in one day last week during spring break. They all went through the Safe Travels program. Almost all of them did it right. But it's going to be a relief when I know that those individuals have been vaccinated, because as important as it is to get our economy going and to restore some normalcy, we really don't want anybody to get sick. And so we're doing a really good job balancing these two things, but I like the idea of the vaccine passport to put us over the top, to make it easier to travel safely, and really to, give people that sense of security, that whether they are traveling with a big group of people, they know they're protected, or when we see these large numbers like we're going to see in the summer and fall, and it will be large numbers, that everyone is a non-risk to us in travel purposes for Hawaii.
We had a few comments on last week of people who are actually on the mainland or some visitors who are saying that they're still having a difficult time finding travel partners that they can take this test to qualify under the Safe Travels program. Is more being done in the expansion of the Safe Travels program to allow more vendors and different contractors who are applying this test to make it more available to people trying to come into the state?
There is, and it's also been a point of contention with others because adding too many partners made the system collapse. Having too few made it too difficult to get a test. But the partnership that we have with Clear and Common Pass is meant to have one system where if people go through, they've already vetted thousands of different testing partners. So Clear, I believe, had 30,000 testing partners across the country. So once that's fully operational, then if you just go through the Clear app, you'll be able to simplify things. We've had really good luck with several companies. Vault Health has been very good. Actually, they've been extremely reliable, and they mail it in, so there's no geographical consideration that people have to worry about. On the flip side, a lot of people like just going to CVS or Walgreens and getting their test. But the case counts have surged a little bit again on the mainland, which always means that there's extra pressure to find a test that you can get done in time. And nobody wants to schedule, a large vacation for their family, a once in a lifetime experience, and then one day out find that they tested positive and can't travel. So really, the vaccine passport is going to be what helps us turn the corner for purposes of returning to normalcy. But for now, the Gov doesn't want to shift or change anything at the last minute. And I will tell you, I think that the travel test will be replaced in the summertime with some form of a vaccine passport as the main way people avoid quarantine. Won't be the only way, because again, if people don't believe in being vaccinated, we're going to respect them. We're going to be civil. Even though I'm a physician and I believe in vaccinations and I got it myself, I still understand that some people are reluctant, and that's okay. But that doesn't mean they shouldn't be able to travel or participate in concerts or whatever. It just means that they'll probably get a test before going to such events.
Yeah, on that subject, we've talked so much about vaccine access and availability for those who want it, but pretty soon with the numbers of vaccine doses that we're getting, the conversation is going to shift to not necessarily the people who want to get it, but the people who might be on the fence, who might be somewhat reluctant. And I've seen some of the comments in here today, people still a little bit wary about getting this given the pace at which it was developed. What can we, what is the state doing to give people a little bit more assurance and also to make sure that enough of us get vaccinated so that it is effective?
So there's a lot of outreach going on. And all I can say is I reach out to groups, hour after hour after hour each day so that they know that I had no problem with it. We're still checking the data constantly, making sure that there hasn't been a change in the side effect profile or that we haven't had new problems. Every week that goes by, there's more data that comes in from the companies. For instance, this morning at 3:30 in the morning, I read a study that showed that the Pfizer and Moderna first shot has provided actually 80% protection rather than the initial feeling that it was only 52 to 55% protection from infection. So it's proving to be even more effective than other people have felt before. But we're getting a lot more data. And of course, now millions and millions of people have taken the vaccine and we're not seeing any widespread problems or challenges. People aren't growing horns and they're not, being tracked with, devices, and they're not having terrible effects. They're just not having them. However, it's okay if people don't believe in it. It's just that from a public health standpoint, in order to get to herd immunity, we have to get over 75% of our people vaccinated, or they have to have had COVID. And that's when society and the world shifts back into normal gear, when we get that kind of herd immunity. So if people do get a vaccine, they're doing something special for their neighbors. If they don't, it's okay. There's other ways to contribute to society and prevent spread, which is to say, wear a mask, have a social distance gathering, don't go to a large gathering or schedule a large gathering until we're safer. So there's lots of ways for people to give back, and we know that they are. And so I appreciate everyone. And then there's another category of people who just can't get vaccinated because they have health concerns. And I really feel for them. So that's the group that I often tell people, please get your vaccine if you can, because you're protecting others who might not be able to.
As our time here wraps up, unfortunately, it is the top of the hour, so we have to wrap this up. But we did want to provide you an opportunity to just have a final word to those who are watching here this morning. There seems to be still a lot of comments with people who are worried about these numbers, the triple digits that they're seeing, and things, the way things are panning out. Your final message to those who are watching this morning.
My message would be this: have a very safe 2 weeks. Have a quiet 2 weeks. Don't have large gatherings. Always wear a mask when you're out and about, and our case counts will come down. It's natural for people to want to get out. It's springtime. People have a sense of security because we've done 604,000 shots, but we are not there yet. In about a month, we will see a lot of extra protection. But again, we need another 4 weeks of vaccines to get to that 1 million shot mark, where I think we'll see a lot of improvement. So please be very careful these next few weeks. Otherwise, we will see the cases surge, and we will have to, backtrack on our tiers. And I think people don't want to go back. So, blessings to people who have been safe, and everyone know that we as physicians are still seeing a lot of people that get sick with COVID. It's not quite over yet. So please be safe for the next few weeks, and then we'll have a much better summer ahead.
Okay, we're looking forward to that great summer. Thank you so much, Lieutenant Governor Josh Green, joining us live from his office at the Capitol this morning. Thank you.
Thank you.
So interesting to hear from him, Ryan. I really like the way he broke down who is getting the virus right now, and his emphasis that it is really people 18 to sort of the mid 40s, as opposed to what we traditionally think of people getting sick who are senior citizens. And that's really just a warning and a reminder to us all to really be careful. What he's sort of laying out is a self-imposed tier 2, if you will, that maybe we don't actually change the rules and regulations, but that we all try to have a quiet 2 weeks so that we don't go in the wrong direction. It really does feel like we're at a fork in the road right now.
Yeah, and also breaking down those numbers on the island of Maui, which is continuing to see that larger number in terms of just when you look at the population size comparatively to the island of Oahu and to an island like Maui. Of course, Maui seeing some of what uptick, and then breaking down where those cases are coming from. We also saw a lot of questions about those who are qualified now to get the vaccine in that 60 and over category. Many saying that they are actually having a hard time finding a way to get an appointment, and also some information on the state vaccination website. He's saying that he'll talk to the Department of Health, but also encouraging people to utilize the pharmacies that they have set up. The pharmacy program, he's saying, has a lot of open availability. And so those who may be having trouble right now, who do qualify, his suggestion is to check in with some of those local pharmacies to see if you can get an appointment there.
Yeah, and also very important to hear that from what we're seeing as a state, those cases are not originating from travel. Those are not visitor cases, that the Safe Travels program, the pre-testing, is helping to weed out potential spread in our community. And so it really is community spread at this point. And so he's encouraging residents to really take responsibility, wear masks, socially distance, do all the things that we've been doing for well over a year now. On that subject of vaccine access, we are going to be diving deeper into that with Dr. Libby Char, who of course heads up the Department of Health and is responsible for this rollout. She'll be joining us here on Wednesday. We hope all of you will join us then as well.
Yeah, looking forward to that conversation with Dr. Char. So we encourage you to enter your questions and tune in again on Wednesday at 10:30 right here on the platforms of the Honolulu Star-Advertiser. Until then, take care and stay safe. Aloha.
Aloha.